Welcome back to the world's okayest physical therapist podcast. I'm your host, Dr. Hint, and today we are taking a look at cupping. But first and always, please don't forget to like, comment, and subscribe and share this with everybody you know as I share my experience and knowledge with you in order to help you better navigate the American healthcare system. Like I said, today we're taking a look at cupping, and this really started gaining popularity and it started gaining traction back when Michael Phelps made them popular in 2016 because he looked like he had been attacked by a giant squid or an octopus. But what most people don't know is that cupping is not for just elite Olympic athletes. It is a legitimate tool that is used in physical therapy clinics across the United States every single day. And as I've talked about before, this channel is slowly becoming more and more geared towards veterans and active duty members. But the thing about veterans and active duty members is they're just like everybody else, except they're a little bit more worn out, a little bit more broken, and they need a little bit more help to do their very demanding jobs. So before you tune out and think, oh, this isn't for me, the truth is, if it works for a veteran or active duty service member, it's going to work even more for you. So today we're diving into cup therapy. Not the mystical ancient medicine that you might see on YouTube, but we're going to be talking about the evidence based application of cupping in modern physical therapy practice. What does the research actually say? When and for who does it work? And more importantly, when should you skip it and do something else? Let's get after it. So here's the reality about cupping. It sits in this weird space between an ancient practice and modern medicine, kind of like trigger point dry needling. People have been doing variations of cupping for thousands of years. Chinese medicine, Middle Eastern medicine, and even ancient Greek physicians used it. But that doesn't tell us if it works. What matters is, can we measure any positive outcomes? Are those positive outcomes replicatable? And can we explain why it works? The short answer is sometimes yes, but the research is getting better. As a physical therapist working primarily with veterans, about 50% of my caseload or more is veterans. I'm going to be honest, I don't use cupping that much, but this is why I'm doing a deep dive on this today. Because I'm trying to figure out when it is most applicable for me to use it. Because I want it to be a tool in my toolbox, but not the only tool I have. So today we're going to cover the different types of cupping techniques, what the current research shows, which patient populations benefit the most, how I would integrate it into my treatment plans, and when I would use it versus when I would skip it. Now, none of this is medical advice. This is just me providing education. You should always seek a medical professional's a consultation with them to be screened to make sure that anything that you see or hear on the internet is appropriate for you. So, let's dive into what is cupping. At its core, cupping is the application of negative pressure to the skin and underlying tissue. Instead of pushing down into the tissue with the thumbs, the fingers, or an assistive device, such as like a Graston tool or something, it's instead pulling the tissue up and away from the body. Most manual therapy is compression based by pushing down and into the body. Cupping is the opposite. How does it work? Well, you apply a cup and you create suction. This creates several things. Mechanical deformation of the tissue. It's literally pulling the skin, the fascia, the fat, and any muscle away from deeper structures like the bone. It can increase local blood flow. By creating this negative pressure, it would draw more blood into the area. And it can have potential neurological effects. It may be stimulating mechanoreceptors in the fascia that can help pain perception as well. It also helps with what's called fascial mobility. That's creating movement between different layers of fascia that may be restricted and tight. Now, here's where I need to be honest. No one understands exactly how cupping goes in and does what it does. There are theories on the tissue mechanics. There are theories on the neuroscience. There are theories on fascia. In fact, if you listen to the last podcast, you can hear some of those theories. But research is still ongoing on why exactly cupping might be working. What we do know is that it can reduce pain in certain conditions, it can improve range of motion temporarily, and it appears to have effects beyond what we call the placebo effect in many applications. However, those effects are often short-term and they require integration with other approaches and interventions as well. So, what are the type of cupping techniques? There is this thing called static cupping. That's where you put the cup in one position, you add the suction, and you leave it there, usually for 5 to 15 minutes. This is used for trigger point treatment, localized muscle tension, and areas that a physical therapist might want to have sustained decompression for increased blood flow or other reasons. An example would be a veteran that comes in with chronic trap pain and tension from years of rucking. Instead of the physical therapist having to wear out their hands going in and doing trigger point release, instead the application of 2 to 3 different size cups across the upper trap in place for 8 to 10 minutes might help release that tension and get some increased blood flow there. Because after all, part of the mechanism is if you get more oxygen and more blood to the area, the trigger point should release. That's part of the assumption of why it works the way it does. Now, there's also something called dynamic cupping. This is where it's also combined with like movement. So this would be where you apply the cup with mild to moderate suction in one place after you've applied some lotion, and you move it across the skin. It's kind of like a reverse massage of pulling the tissue up and away. This is usually used for people that have fascial restrictions. It can improve tissue mobility along muscle bellies. So that's where you're following the grain of the muscle, trying to get it to improve mobility there by, again, increasing blood flow. It has some evidence that it works with the IT band, and it also can help with thoracic spine mobility. An example for this would be someone that's limited with like a movement, say reaching overhead due to like tightness in the lats. You could put some lotion on that tissue, apply the cup with moderate suction, and then move it up and along the grain of the the lats. And then you can try and create this glide that gets more blood in there, and it can help ease that tension for the lat. You could also, in this same instance, use a glide from the thoracolumbar junction up to the posterior shoulder. Again, you're kind of following that direction, that almost diagonal 45-degree up between the shoulder blade and the middle of the back. Another type is called flash cupping. This is the rapid application and release of cups in the same location. It's pumping up the cup quickly into that pressure and then taking it off quickly, usually 15 to 30 repetitions in one spot. This is designed to stimulate circulation and stagnant tissue. It's meant to help with areas that are too sensitive for normal static cupping, and it can be also used as a warm-up before other manual techniques. Active cupping is really interesting. This is one where you apply the cup and you have a person move while the cup is still applied. This is used for addressing specific movement restrictions, integrating decompression of the tissue with functional movement patterns, as well as creating immediate feedback for movement quality. Now, this is basically where the brain is now paying more attention to that specific area that has the cup. It gets better biofeedback, and it can modulate how it wants to move the body based on that feedback. An example of this would be someone who has really bad anterior shoulder pain and they're limited with, say, internal rotation. A cup could be placed on the back of the shoulder, and while the patient is going through internal rotation, you can select the place where you think the cup is most likely to stay along the muscle belly, and using the decompression of that posterior tissues, it might help loosen up the range of motion. And it basically what you're trying to do is stimulate the nervous system into a new movement pattern. Again, by adding that decompression, adding that biofeedback. The last one is called trigger point cupping. This is combining acupuncture or trigger point techniques with cupping. This is placing the cup directly over a trigger point with enough suction to cause mild discomfort. This is usually used in stubborn trigger points that don't respond well to just hand pressure, ischemic pressure. This is also areas where direct pressure might be too painful, and it can be chronic trigger points in a much larger group. It also, I said earlier, it can be combined with acupuncture. I've never seen it combined with acupuncture ever. I guess that it could be based on the research that I saw, but I think most of the time this is just used by physical therapists who don't have trigger point dry needling certification, and they are dealing with a stubborn trigger point, and they don't want to have to waste all of the energy and strength of their hands going after it when they think a cup could solve it for them. Honestly, between all of these, the trigger point cupping and the dynamic cupping are probably the two I'm looking to use more in the future. So the evidence. This is where things get interesting and frustrating. The challenge with cupping research is that most studies are very small, the methods vary widely, and there's no standardization of technique, duration, or pressure. That makes comparing the studies very difficult because there are so many variables that you have to take into account. but there is slowly better data coming out. What the research currently shows is that chronic neck pain patients, through several systematic reviews, show cupping can reduce pain and improve function in chronic neck pain. A 2021 meta-analysis found moderate evidence for short-term relief between 2 to 4 weeks when combined with other interventions. That's kind of what I would expect even from using your hands, but this might be an indication to me, for example, and other physical therapists listening, that using the cupping can save the hands and allow them to be used for other patients later in the day that need it, especially if you can use cupping to help improve cervical pain, which is, again, one of the areas that I spend a lot of time with my hands, a lot of upper trap, a lot of scalenes, a lot of SCM. This might be a tool that I can use to save my hands, to make them last a little bit longer. It works, but the effects don't last very long without other interventions like stretching and strengthening, and that's just true with any sort of manual therapy as well. Low back pain. The strongest evidence that I found was that there are several high-quality studies showing cupping reduces pain and improves disability scores in chronic low back pain patients. A 2018 systematic review, I got it right that time, found it comparable to conventional treatments. This means if you're dealing with low back pain that's chronic from years of, say, rucking, jumping out of aircraft, sitting in vehicles, cupping combined with exercise therapy has been shown to be of real benefit. Chronic shoulder pain, emerging evidence is coming out for rotator cuff issues. Some studies show improvements in pain and range of motion, but again, this is when it's combined with exercise. Carpal tunnel syndrome, interestingly here, some studies have showed that cupping applied to the form of the hand can reduce symptoms. This might be due to the fact that this person is having carpal tunnel because of inflammation more than anything else. And it might also help improve some tissue mobility, but that was an interesting one. Athletic performance and recovery is mixed. Some studies show improved recovery markers, others show no significant improvement at all. But again, keep in mind how variable the pressure is, the duration, and the type of techniques. So my take is for true performance enhancement, there's no good evidence. For recovery from intense training or addressing chronic restrictions that limit performance, that might be where I see some value. The patient that I perform cupping on the most is someone who runs marathons. And every single time after they come in with the marathon, without fail, they'll come in and they will get cupping across the low back and the shoulders, and then they will want decompression, or they'll want compressive boots on as well. So what doesn't have strong evidence? Systemic detoxification, right? That's something that people talk about, like, oh, you can use the cupping to do this detox. No. Chronic diseases, curing them? No. Removing toxins from the blood? Again, no. And then having long-term structural changes from a single session? No. Like anything manual, if we could do that as a physical therapist, we'd be out of a job. We wouldn't need to go and do anything else. Like anything with life, your body responds to loading and tension and pressure. And yes, you're going to see short-term changes from cupping, but if you don't go in and do movement, stretching, and exercise, you're not going to maintain it. So who benefits? Was that quid bono? Latin for everybody. There you go. So if somebody walked into my clinic and I was skilled enough in these things and I practiced enough on myself that I was comfortable doing it, who is getting cupping? Chronic pain patients with muscle tension would probably be the first one on my list. I'd be looking to see if they have any significant muscle guarding or tissue restriction, because cupping might help neurologically condition them to accept some sort of tension through that muscle without feeling pain. Maybe I can use it to help break this cycle and get them moving again. A really good example would be somebody shows up with, like, let's say, chronic neck and upper trap pain from years of analyst work, sitting there in the computer chair, shrugged the whole time with their head in that forward head posture. And let's say that, for whatever reason, traditional stretching and strengthening aren't working because the tissue is just so tight. I've gone in, I've used my hands a couple of times and they've seen real improvement, but it's the end of the day, my hands are shot, I don't have the strength. Cupping gives me a window to improve their tissue quality, and then I can try and load them afterward and help them stretch afterward. But it helps save my hands if my hands are just not up to it that day. Because keep in mind, a lot of physical therapists see between, 11 and 12 people every day. If every single person that comes into the clinic gets their, quote, 10 minutes of massage, that's 2 hours. That is 2 hours that a physical therapist is using their hands. But at the end of the day, they're not going to have a lot of hand strength left to try and go after those trigger points. It's just a fact. I'm sorry. I know everybody wants their nice massage, but the fact is, physical therapists, one of the reasons why they leave the field so early is they get really bad arthritis in the hands, or they have like wrist issues, carpal tunnel, all that thing, because they overuse their hands in manual therapy. So this is a tool. It may not be everybody's favorite tool, but this could be a really useful tool for a physical therapist to use, especially later in their day. The biggest one I think I'm going to use it on, me personally, is just by the sheer volume of people that I see that have this issue, is fascial restrictions. When tissue layers aren't moving properly, I'm going to use this to go in to increase blood flow to try and get the mechanoreceptors to relax and to get the fascia to glide. This is common in people with older injuries, surgical scars, chronic immobility, myofascial tightness, things like that. This could be somebody who's coming in with, like, say, a history of really bad knee pain, patellofemoral pain, but nothing seems to be helping. I've tried manual therapy and it seems to help a little bit. I might take the cupping to that and just see if using negative pressure is what I'm missing. That if instead of compression, the body's wanting decompression. Something else I could try and use it for is movement restrictions with soft tissue. Like if a person has pretty good mobility in the joint, but they're being limited by something that's tight, like an IT band, I might go in there and try and use that. Athletes with heavy training cycles, I already talked about that. I'm not going to use it to improve their performance, but I am going to try and help them after they've done something particular high training volume. For example, like CrossFit athletes, marathon runners, power lifters if I'm at an event or something, things like that, to try and help keep the tissue happy and not let it tighten down. People I might consider it on. I have to do more research on this, but I would possibly consider this on someone that is pretty far post-surgery, especially if they're having issues with scar tissue being restrictive. And that would be, again, assuming that the scar is very well healed, where weeks past any sort of concern. I might go in there and try and use this on the scar to see if that helps. But generally speaking, manual therapy has been more than enough effective for me and the patients that I see to help. And the last one, of course, is desk workers, like I talked about, the analysts with posture pain. I might help with this just in term to get more blood flow to those muscles, and then to improve the quality of the contraction and to improve their biofeedback. So when they go to do any sort of periscapular strengthening, it's more effective. Now, all of that to say, who should skip cupping? Anybody who has active skin infections or open wounds or anything contagious? No. Anyone who has severe varicose veins or blood clotting disorders? No. They should skip it. These are all people that should skip it. Acute injuries within the first 48 to 72 hours? Yep. Recent surgery patients? Yep. Areas with reduced sensation because they can't feel pain? Yes, you should skip it. Active cancer in a treatment area? Definitely should skip. Pregnancy? Definitely should skip. People on blood thinners? Skip, 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 skip. No. Anyone who's been sunburned or severely inflamed skin, like let's say a rash or a breakout or anything like that, an allergy? Nope. Definitely not. I would not even consider these people. How we use it in the clinic? Cupping is never the only intervention. It's only ever a tool in the tool bag of a physical therapist. The real work is stretching, movement, loading, and motor control. So usually, here's a quick look of how this would go. Patient comes in, I ask them how they're going. Are they doing their home exercise, where they feel tight, where they feel any sort of issues, if they're still having the same amount of pain, if they're having any sort of restriction with motions that are new, if it's the same thing. Then I might have them lay down. I kind of run my hand over the area. I'm like, all right, is this a muscular restriction? Is this a fascial restriction? Is it the joint? Is it neurological? Is there numbness and they're tingling? And I kind of find the area that they're talking about. I zero in on it by asking a lot of questions. And then I go, okay, here's the sort of cupping I'm thinking this might help with. And let's say I'm thinking it's trigger point dry needling. So I'm going to do static cupping for 8 to 10 minutes over a cluster of areas, trying to really hit, say, the infraspinatus. Go in there, I do that for 8 to 10 minutes. I might do some soft tissue mobilization in a couple of other places with my hands. That's a little bit less demanding. And then after those 10 minutes, I take the cups off and I immediately go into exercise. And I'm going to try and use an exercise. Again, this is me speaking. This is not medical advice, but I'd immediately try and put them into an exercise that I know is going to make them use the greatest amount of range of motion with a decent load. Maybe even a light load at first to see how they tolerate it. So for the infraspinatus, I would be doing what I call scarecrows, which is shoulder external rotation at 90 degrees of shoulder abduction, which for everybody else is effectively doing the field goal symbol, like when you kick a field goal. That's basically the position I'm going to put somebody in. I'm going to try and load them there. After that, I'm going to be checking their scapular control. I'm going to be assessing if it's less painful, if it's moving better, if it's less tight, whatever their complaint is, I'm assessing to see if it goes down. If it goes down, awesome. I keep loading a little bit more, and I'm focusing on strengthening that area with a whole variety, a whole host of different exercises to just see if it responds any different than it has in previous sessions, and it improves their muscle contraction quality, their stability, so on and so forth. Then after that, we discuss why maybe it worked, maybe why it didn't work, and if we'll try it next time if we need to. And then if it's gotten us some more range of motion or ability to accept load, I might go in and change the home exercise plan to be updated to reflect that. In reality, that takes about 5 to 10 minutes, but that 5 to 10 minutes is money. I usually spend 5 to 10 to 15 even minutes doing manual therapy on a lot of patients anyway, so cupping is just another tool that I can use, and it's something that I would likely use to save my fingers anyway, and I think, to me, knowing the power of manual therapy already, that's hands-on stuff, I've justified in my mind doing that time-wise instead of just trying to sneak in more exercise or stretches. Does that mean I'm going to use it on every patient, every session? Absolutely not. Cupping is probably something I'm only going to use in the beginning as much as I need to until I get the tissue being happy and accepting more load, and then I might not do it again ever. Depends on the patient. So let's wrap up with some practical wisdom from my time in the clinic. Tips for patients. The marks, the size, the purpleness of the marks from the suction cups doesn't reflect whether the treatment was better or not. Like a darker purple mark doesn't mean it was a better treatment or a better session. Don't chase the bruise. The bruise is not the end all be all. It should feel like a deep stretch. It shouldn't feel like torture. Discomfort is okay. Pain is not. Hydrating is critically important. This isn't about flushing out toxins, though. It's about supporting tissue recovery and maintaining your blood volume. Move afterward. The goal isn't to get cupped and then just chill out. It's to move gently, to check your range of motion, to do your exercises, to walk, all of those things. Again, assuming you've been cleared by a medical professional to do so and you're under the guidance of a medical professional. Common mistakes that a lot of clinicians make, according to the internet, is people use it as a standalone treatment, which I can totally see. They just do cupping and say, all right, you're done, bye, don't worry about anything else, and I think that's just dumb. I think it should always be combined with stretching and exercise. Overusing pressure, creating as much pressure as they can to get the maximum mark for the bruising, that's just, there's nothing in the evidence that says that that's necessary. Ignoring contraindications. All the people that shouldn't be getting cupping, definitely there's going to be medical professionals out there that will probably break that. Either because they're not told and they don't know, or they think that they can still do it anyway. And then not educating patients is the biggest one that I see. Even in the clinic, when it doesn't revolve around cupping, a lot of times people don't take the time to do what I'm doing right now. Sit down, have a conversation, and educate people on why we're doing this and how it's beneficial. So the bottom line on cupping and physical therapy is it's a legitimate tool with growing evidence, but it's not magic and it doesn't cure everything by itself. It's useful for specific conditions, like the ones we already talked about. The key is integration. Cupping creates a window of improved tissue mobility, and how the physical therapist utilizes that is what's important in terms of stretching and strengthening. It means that exercise, movement retraining, mobility are all necessary to address the root cause. That cupping has opened the window for us. For the veteran population specifically, cupping can be particularly useful. Years of load carriage, impact, and chronic tension can create tissue restrictions that respond well to decompressive techniques. But don't expect it to fix every single deployment-related chronic pain by itself. That's where movement and strengthening still come into play. If you're considering cupping, you should always talk to a medical professional, and you can find a licensed provider. A lot of people, a lot of medical professionals do this. Physical therapists, chiropractors, licensed acupuncturists. You can ask on the phone before you even go about their training and approach, and then you can expect it to be part of a comprehensive plan, not the whole plan. If it's the whole plan, that's a problem. You can give it 3 to 4 sessions to see if it helps. That would probably be about 2 weeks before you would know if it's really helping or not. And if you're not seeing results by sessions 4 or 5, I'd probably talk to whoever it is that's providing you the cupping and say, hey, I just don't think we're seeing the results that I was looking for. And remember, the goal isn't to need cupping forever. You don't want to be addicted to the cup. It's to use it to strategically restore tissue mobility and then build your capacity so you don't need it anymore. That is operational fitness. That is what is sustainable. So, thank you so much for listening. Again, please don't forget to like, comment, and subscribe, and share this with at least one person that you know. And please check out 10,000. The link down below is for 15% off their shorts, t-shirts, and pants. And you'll notice they've probably recently jumped in price because hasn't everything. So that 15% can be really nifty. Check the show notes on Patreon for the references to the different articles and research papers that I used for this. And now everybody stay healthy, stay fit, and stay awesome. And I will catch you guys all in the next video.